Oh my God.
On this episode,
You can't really tell that she has a tail, but inside of those folds, it's horrible.
For her well-being and quality of life, we need to get this out of here. She's got a lot of fat in here, so that's making it a little bit difficult to see. Golly.
She does feel really bony. Yeah. Oh dear. That is not good. This is much more urgent than I thought it was. She needs a blood transfusion if we have any chance of being able to save her.
but first,
It's big. I mean, it's real big. When I feel a mass this big, I really worry about cancer. I need to do a rectal exam on her just so I can check. I'm sorry. Such a brave girl.
Hello, Missy. Hello, Doc. Good girl.
at Sash in Western Sydney, vet nurse Jess has arrived for an appointment with Mara. She's worried about Missy, one of her 2 rescue dogs.
Come on, let's go.
Jess is one of our emergency nurses. She often brings her dogs in with her for work, and I actually run the blood bank, so I'm really happy that she brings them in because they donate blood, which helps us save lives of other dogs.
Sit. Good girl, miss.
Jess wants Mara to examine a worrying lump on one of the much appreciated blood donors.
Missy! Hi, baby.
Good girl, miss.
So she's got the swelling here?
Yeah, I just noticed it yesterday,
Okay.
but it just appeared quite acutely.
Magically,
Yeah.
huh?
Yeah.
Oh, good. Is she otherwise acting normal for her?
Yeah.
Anything seem off?
No, nice and healthy.
Okay.
Eating normally, no vomiting, no diarrhea.
Okay.
Missy was scheduled for a blood donation this week, but yesterday I noticed this mass swelling under Missy's chin, and we had to put a hold on the blood donation and bring her in and check that out.
And has she ever had anything like this before?
She does have a history of lumps appearing.
Okay.
Only started to happen about 3 years ago.
Okay. All right. This is pretty big. Silly girl. What do you got going on, Missy? This mass is huge. Probably about the size of a baseball. And I really need to try and figure out quickly if this is something really serious or if this is something relatively benign.
So the first ones were both her lymph nodes.
Okay. At her shoulders?
No, submandibular
Okay.
ones.
Okay.
Yeah.
Same location as this one.
Yeah.
Okay.
But not as large.
Okay. When I feel a mass this big and firm and almost bouncy, I really worry about cancer. She seeming sick or unwell at all?
No.
Just seem normal. And then you're like, oh,
Yes.
she's got these big
Swollen
swellings.
lymph nodes. Yeah.
Okay, all right. I really don't want this to be something bad because Jess is right here. And if she realizes how concerned I am, it might freak her out.
Good girl, Miss.
All right.
Come on, good boy. There's your bowl. Who's that?
At Sydney's Small Animal Specialist Hospital, Olivia is having a chat with Trevor the lorikeet.
Come on, quick, get your bowls. Yeah, so funny.
As her first patient arrives,
Hello?
Michael and his mum Beck are worried about their pet ferret Cookie, who is extremely lethargic and has lost a lot of weight.
She's one of those ferrets that has her eyes open when she sleeps. She's out like a light.
Hello.
Hello.
Good. Would you guys like to come through?
Yep.
Yeah. The first thing I notice when I look at Cookie is that she is just skin and bone. I'm really worried about how skinny she is. All right, so how old is Cookie?
About 2.5.
Okay.
She's a rescue, so we don't really know the exact age of her.
Right. How long have you had her for?
4 months.
Was she skinny when you got her, or has she
Skinnier
become...
than this.
The people that we rescued her from, they kept her in a cage, and all she was fed was dog biscuits.
Oh.
When we came to pick Cookie up, saw that she was pretty much just skin and bone. She wasn't really doing well, so we were like, we have to do something.
She's lucky she ended up with you guys.
Yeah.
She's a very people person, as you saw, like sleeping on my arm, like climbing up my arm to be on me. She's just like my baby. She's like, I see all my animals as my children, they're dependent on me. So we're hoping it's a happy, healthy life for Cookie.
Okay, well let's have a look at her and we'll see what's going on. Hello, sweetheart.
It's okay.
Hi, little Cookie. She does feel really bony. There's not much to her. I'm going to pop her on the scales first and we'll get a weight on her. Good girl, Cookie. Good girl, sweetheart. So she's weighing at 395, which is really worrying because most female ferrets would be between 600 and 900 grams.
It's okay.
The other thing I do notice when I look at her face is her nose and her ears look quite pale. She might be anemic, so she might have low red blood cells. This is really alarming. When I look at Cookie's facial features, they're really pale and they should be nice and pink. And what that tells me is that her perfusion or her blood circulation isn't going very well. And when I'm holding Cookie, she just feels like skin and bones, and that's really worrying for me. Good girl. So what I'm going to do now is just have a little listen to her chest. Good girl. You're being very brave. Okay, so listening to Cookie's chest, I'm a bit worried because I can hear a murmur. And what that means is that the blood flow in her heart is what we would call turbulent or a bit irregular. And that often can indicate that we have some kind of heart disease going on. As if things couldn't get worse for Cookie, now I can hear that she also has a heart murmur. But right now, I'm really worried that she might be really anemic, and I think we just need to focus our efforts on that. We need to do some blood tests so we can figure out, truly is she anemic, and if so, how anemic is she, and what else is going on with her internal organs. Are you guys happy to go ahead with that today? Yeah. For Cookie? Okay, great.
It is a huge concern just how much colour she actually has lost.
We're hoping it's not sadly we have to end it here so you don't feel any more pain.
Hello, sweetheart. Aww. Do you just want to hide? That's all right. You can hide.
Cookie's still fighting, so we're going to be fighting with her.
Good girl, Cookie.
We are here.
In Atlanta, Georgia, Jasmine has arrived to see Arvid, concerned about a baffling issue with her 8-year-old English bulldog, Duchess.
Hello. How are you?
I'm good. Hi, Duchess. Hi, Duchess. How are you?
Love to get scratches. I don't know what we would do without Duchess. Life hasn't been the same since Duchess came in, and we just love her.
Hi, how you doing?
Good, how are you?
Dr. Edward, nice to meet you.
Nice to meet you as
All
well.
right, or you can call me Dr. Arvid, either one.
Okay, okay.
This must be Duchess.
It is.
The famous Duchess. I know she's been having a couple of issues you wanted to kind of talk about.
Yes. So she was spayed a few years ago, and a little while after that spay, like maybe 3 months after that spay, she started to show signs of heat.
Well, that's not normal.
That's what I thought. I'm like, wait a minute. I
That's
thought
not
that
right.
took care of that.
Right.
So she started showing signs of heat, and so after that, it's been consistent, as if she was in her normal heat.
Okay. I don't know if you ever heard of a term called ovarian remnant syndrome.
No.
That sounds like what it could be. So when they get spayed, sometimes whoever did the spay either could have left a piece of the ovary behind, not taken all the ovary out.
Okay.
Or sometimes, especially in certain breeds, they can have what's called an ectopic ovary, meaning that it developed in an area where it shouldn't.
Naturally.
Naturally,
Okay.
and it just got missed. So that's all possible as well.
Our other issue is her tail.
Okay.
It's constantly getting inflamed, like just gooky, nasty, and you can't really tell that she has a tail, but inside of those folds, it's horrible.
Very common with English bulldogs.
Okay.
And a lot of times they'll get what's called like the vertebra, the spinal bones will become fused, and they'll create this little downward or spiral.
Okay.
look to it, appearance to it, and that tail becomes basically non-functional. You know, it doesn't move. The thing about these corkscrew tails is that they create excessive skin folds back there by the anus. So from the feces and just moisture getting in these folds, great breeding ground for bacteria. You can see there's no air getting in here.
Right.
And because there's no air getting in, you can see all this infection that's building up in there.
Yep.
See
And all of that. Oh,
all that just
yeah.
comes out. So now what do we do, right?
Exactly.
That's the magic question.
Exactly.
That's the magic question. What do we do?
What do we do?
All right, surgery to go in and remove the tissue. Most of the time, if there's an ovarian remnant or an ovary left behind, it's gonna be near the kidneys, and you go in, take it out, problem resolved. And then the way to fix the tail is surgery as well.
Okay.
Okay?
Sounds good.
All right.
Right? Oh my goodness.
Big mama.
Big girl.
She's in a lot of pain right now with that tail, not to mention she's having these hormone surges, so we're gonna take care of that.
Oh my goodness, look at these chubby little legs.
It's so gratifying knowing that when it's all said and done, she's gonna feel fantastic.
It's okay, baby.
Duchess is a bulldog, and with bulldogs, you never know what you're gonna get. Despite what anyone says, no surgery is ever routine. I know sometimes people may say, oh, it's very routine, but with surgery, anything can happen at any time. Always expect the unexpected. So no such thing as a routine surgery. So we're just crossing our fingers that everything goes smoothly here.
She's a good girl. She's a very good girl.
Hello, beautiful girl. She's so cute.
At SASH in Sydney, Olivia and Nurse Charlie are about to run blood tests on 2-year-old ferret Cookie, who is dangerously thin and possibly anemic.
So we'll try the jugular vein. See the vein there? Now the question is, will she sit still for us? Good girl. Do you want some oxygen? No. Ferrets are very wriggly creatures, and normally trying to take bloods from a ferret would be impossible without a sedation or an anaesthetic because they're just moving around too much. You are so brave. Just don't pull her head up too much. Perfect. Okay, perfect. With Cookie, we were actually able to get some blood from her while she was awake, and that tells me that she's probably feeling pretty sick. I'm gonna try and find out what's going on with you here, Cookie. See if we can make you feel better.
The main test is to count Cookie's red blood cells. If the number is down, it could explain why she has so little energy and sleeps most of the day.
Her blood is very watery, which is a worry. Red blood cells are essential for carrying oxygen in our bloodstream and delivering oxygen to the tissues. So if our red blood cells get low enough, we become really weak and unfortunately we can die. Wow. Oh wow, this is really bad. Oh dear, that is not good. The results have come back really low. I was hoping for a red blood cell level of at least 30 and she's only got 8%, which is really concerning.
To confirm if her worst fears are correct, Olivia looks at a sample of Cookie's blood under the microscope.
That's not good. Poor Cookie really doesn't have many red blood cells left at all.
The alarmingly low cell count means Cookie is fighting for her life.
This is much more urgent than I thought it was. Her red blood cell levels are dangerously low and I think she needs a blood transfusion if we have any chance of being able to save her. Hey, darling girl, you gotta eat something. Good girl, Cookie. Good girl.
This mass is gigantic, huge.
At SASH in Western Sydney, Mara is examining her colleague Jess's dog Missy, who has a large lump under her chin that could be cancerous.
This really is quite firm, but it doesn't seem to be painful. Such a brave girl. When I see a lump along the face or neck, my big concern is, could it be a tumor? If I'm lucky, it's some type of infected lymph node, but cancer is really my biggest concern at this point. Let's see how the rest of you is. Can you feel your other side, darling girl? Just make sure everything else is looking okay.
Mara wants to see if the swelling is isolated or if the 5-year-old has similar worrying lumps on other parts of her body.
So she's got a lump right here on the left in her groin, which I'm not feeling on the right side at all. Doesn't seem to be painful for her. She doesn't seem to care that I'm squashing it. And then also the left front by her shoulder, that lymph node feels a little bit more firm. So I need to do a rectal exam on her just so I can check some of the internal lymph nodes and see if any of them are big.
All right, let's do it.
I'm sorry.
Missy is a rescue, and then about 2 months later, my mum brought home Zara, and then I claimed Zara. They're both 5 years old, about a month apart from each other. Zara is more the attention-seeking girl, and Missy is ball obsessed. Ball, ball, ball. Good girl, miss.
Don't hate me. You don't need to be tense. She's very worried.
I'm just not sure.
Yay, your lymph nodes feel good. All right. Well, I would recommend that we try and get some samples of cells, definitely from this big one under her jaw. We'll just do a little kind of clip and clean, needle and syringe, try and see if we can get some cells. Look at it here in-house.
Yeah.
If it's not obvious what is there, then we can send them off to the laboratory to be looked at by a pathologist and figure out, is this an infection? Are they just inflamed? Is there something more sinister going on, like cancer? Hard to say, but start with that.
Okay. Good girl, Missy. Missy is a repeat offender for suspicious lumps. I do see them quite a bit in clinic, but when it's your own dog, it's always a bit heart-sinking. Okay, good
so brave.
girl, miss. Yeah, good girl.
Such a brave girl.
I'm a little nervous with this surgery because I don't know what to expect.
In Atlanta, Georgia, Arvid is about to begin surgery on English bulldog Duchess to try to find out if ovary tissue was left behind during a previous desexing.
Now, the ovarian remnant surgery can be very tricky because the ovary is not always where you think it's going to be. Hopefully it's behind one of the kidneys, which will make this procedure pretty routine, and I can go in and get it out. So another thing that can add to the complications of this procedure is that she's already had a hysterectomy before, and sometimes that can result in some adhesions from the previous surgery, which can make things a little bit more difficult. She's got a lot of fat in here, so that's making it a little bit difficult to see, especially there's a lot of fat covering the kidney. So just trying to look at that bottom portion of the kidney to see if I see what looks like an ovarian remnant. Oh my God, golly, we got a winner. She's got a pretty huge ovarian remnant on the right kidney. I mean, this thing is so big, I thought it was the kidney. Now we just gotta take that out.
Hey, Beck, it's Olivia here at Sash Vets. How are you going?
Hey.
At Sash in Sydney, Olivia is calling Beck with the news that the family's beloved ferret Cookie is severely anemic and could die within hours.
Unfortunately, it's really not good. Her percentage of red blood cells is at a really critical level, and if she loses more red blood cells, I just can't, unfortunately, guarantee that she's going to survive. So,
Oh, wow.
yeah. Beck and Mike love Cookie. They're so dedicated to her. They rescued her from a really dire situation and they really want to do the best for her. And I feel so bad for them because I know that Cookie is really sick. She would need a blood transfusion if we have any chance of keeping her alive.
Okay.
So we need to try and find a healthy ferret who will donate blood. Trying to get a donor ferret is no easy task. We don't just have a pool of ferrets ready to go to be blood donors, and we need to address this anemia urgently, otherwise she's going to die. We're kind of in between a rock and a hard place, because if we don't do the transfusion, unfortunately she won't make it. We won't be able to keep her alive, but it's not necessarily going to fix whatever the underlying cause of her illness is, so that still remains a mystery.
Can we use one of our ferrets?
Absolutely. The biggest one that you have would be great. The biggest, youngest and healthiest. Hulk, yep, he sounds like a good candidate. I am really lucky today because Beck and Michael have other ferrets at home, and they're willing to allow us to check those ferrets over and see if they can be used as a donor today.
So I'm going to go home, get Hulk and Princess and bring them over.
Okay, all right. Thanks, Beck.
Okay, thanks.
We'll see you soon.
All right. Okay.
Bye.
Thanks.
It's now a race against time to keep gravely ill little Cookie alive.
Such a brave girl. Very brave.
In Western Sydney, Mara is taking tissue samples from Jess's dog Missy to check if the 5-year-old has cancer.
Good girl. Good girl.
Okay. Whenever we have a mass, the first thing we want to do is stick a needle in it, because if I can get a sample of the cells and see them under the microscope, I might be able to right off the bat know, is this cancer? Is this infection? Is this something completely different that might not be on my radar? One last one. In her groin is all I'm going to need.
Mara has found several lumps, but is desperately hoping they won't prove life-threatening.
Okay, my love. Don't hate me. We always joke that the pets that belong to vets and vet nurses are more likely to have really bad things found. So I'm never going to just automatically assume that it's going to be right. Very loving.
As well as tissue samples from the various lumps, Mara takes a blood sample for testing.
Good girl. Good girl.
Missy is keen to be reunited with Jess's other much-loved dog, Zara.
Good girls. When a lump comes up, it's always suspicious, but in Missy's case, they tend to be inflammatory related, not cancer cellular related. So I'm hoping that's the case this time. But I'm still concerned about the lump under Missy's chin. Yes, good girls.
It's now an anxious wait for the blood results and for Mara to complete the analysis of the cell samples.
All right, some skin cells, some white blood cells, some red blood cells.
Oh my God, golly.
In Atlanta, Georgia, Arvid has made a startling discovery.
Wow.
A large piece of ovary that was missed during an earlier desexing.
I mean, this thing is so big, I thought it was the kidney. You know, we just gotta take that out.
The ovary is the reason the 8-year-old has continued to come into heat.
She's got so much fat, it keeps getting in my way, so I'm gonna have Addie just kind of hold some of this fat out the way so I can go ahead and ligate this ovary and get it out of here. All right, teamwork makes the dream work.
Hey guys, that's a mess. Goodness.
I know.
Hey girl.
Okay, so did not see anything on the left. Definitely nowhere near as obvious as the right. The size of this ovary, I mean, it's pretty big. It looks like it might be 2 to 3 times what a normal ovary would be. So done with this, about to close her up. All right, so we're done with round 1. Now we're getting ready for round 2, so we can now start on the tail next.
Arvid now must remove Duchess's corkscrew-style tail that is constantly inflamed and infected.
There's a lot of benefits to doing this for Duchess, but there are a few risks involved as well. The biggest risk is that when I'm doing this surgery, and I get ready to remove the tail, if I do what's called a tethering motion, where I'm kind of pulling and I pull that nerve, it could result in her being incontinent, both defecating and urinating. So that's a very crucial part of this surgery. And you can see here how inflamed and how deep all that goes. So for her well-being and quality of life, we need to get this out of here.
Blood transfusion into her as soon as possible.
In Sydney, Olivia is preparing to give seriously anemic ferret Cookie a much-needed blood boost. Cookie's owner Beck arrives with the young ferret's roommates Princess and Hulk, hoping one of them will be a suitable blood donor.
And it helps Cookie. A bit overwhelmed, really. I mean, we brought her in as a rescue, not realising there was all these underlying issues, and now suddenly they've come to the fore, and yeah, it's a bit overwhelming, but yeah, she's a fighter.
Hey Beck. Hello. How are you going? Come in. Is this one Hulk?
Yes,
Hulk. Princess. The kind of donor I'm looking for is a healthy ferret, a young ferret, and ideally a male, because males are bigger, and so that means I can take more blood from them. And I'm in luck because we have Hulk and he's a male ferret. Looks nice and pink, which is good. It's what we like to see. You're going to be our donor today and help save Cookie. Right, let me just have a little listen to his chest. Happy with what I can see so far. He looks pretty healthy, pretty suitable low-risk candidates. But there are some risks because we do need to give our donor ferret a small anaesthetic to be able to get a bit of blood.
But the transfusion will be far more dangerous for Cookie.
She could have a transfusion reaction. I guess the good thing that works in our favour is that ferrets don't have a blood type, unlike people. So it's a little bit less likely, but it is still possible, and they unfortunately can be fatal. There is also the risk that we could overload her heart and that she could go into congestive heart failure. So the transfusion itself is risky, but if I don't do a transfusion, she's almost surely going to die. Can you say goodbye?
Behave yourself, okay? You'll be a good boy. We've already lost 2 ferrets and now possibly a 3rd, but Cookie, she's a tough cookie, so if we can save her and even get just another 6 months with her, it's worth it, definitely.
Hello, beautiful girl. Okay, I am giving Cookie a sedation so that we can safely place a catheter in her vein so that we can do the blood transfusion. So this is a really critical time for Cookie. Good girl. Sorry, Cookie. I know, it stings a little bit.
But before the transfusion can begin, Hulk must first undergo a blood test to confirm he's a suitable donor.
Hi, Hulk. Are you going to donate some blood?
Right now, he's Cookie's only chance for survival.
Okay, ready, Charlie?
Yeah.
Good boy.
Hello, red blood cells. There are many of you in this slide.
In Western Sydney, Mara is examining tissue samples taken from her colleague's dog Missy to see if cancer is present in any of the cells.
Some cells I squashed, but so far at least I am not seeing anything that is making my heart sink. Yeah, none of that is exciting so far, which is good. While I might enjoy exciting things, it's actually better for the patients if something's boring. We will see what the other slide shows.
As Mara examines the final slide, Jess's other dog Zara is feeling a little left out, with all the attention on her 4-legged housemate.
Missy and Zara both get along, but Zara is more the attention-seeking dog, and Missy is maybe a bit more nervous around new people.
We're definitely going to have a pathologist look at these slides. Definitely nothing to worry with that one. Missy's slide was beautifully boring. There was nothing worrisome on there whatsoever. I could easily see nice normal cells that I could recognize right off the bat. So this is one of those times where Missy should embrace the boringness.
However, Mara is still concerned about the massive swelling under Missy's jaw.
It's big. I mean, it's real big. It could just be inflamed, so I might start a course of antibiotics. But while I'm a specialist in emergency and critical care, I am not a specialty pathologist, and I would never, ever be able to 100% say I can give a definitive diagnosis based on what I'm looking at under the microscope. So all of these samples I'm going to be sending off to a pathologist to be reviewed so that we can get a definite answer.
Good girl.
Hey, Jess.
Hi, how did we go?
So we were able to look through the cytology of the slides. I'm really not seeing anything very worrisome whatsoever, which is good. So I'm still going to send those off to the pathologist to be read out just in case there's something that I'm missing.
Okay.
But so far I didn't see anything super scary, which is good. And all the blood work that we did, really there's no major abnormalities at all. So liver looks good, kidneys look good, white blood cell count is good. So I'm hoping that this is just an infection.
Okay.
Okay.
Thank you.
You're welcome.
Definitely relieved now that we have a bit more of an answer.
Inside.
I always trust Mara's opinion, but still cautious and waiting for these results.
Come on. This way. Let's go.
Okay, let's run this.
At Sash in Sydney, Olivia is testing Hulk the ferret's blood to see if he's a suitable donor to give a life-saving transfusion to gravely ill ferret Cookie.
Perfect. PCV is 39, so we are good to go.
Hulk's blood is safe to use. It's a massive relief.
Let's see if we can find that vein again. Sorry, mate. Good boy. Good boy. Almost there. Alright, I reckon that's just about enough. Let's give you some fluids and wake you up. I'm feeling really grateful because without Hulk, we wouldn't have a blood donor today. It's all right, Cookie. It's all right, sweetheart. Good girl, be brave for me. But I'm just really worried about Cookie. She's gone pretty flat, so I need to get this blood running as soon as possible. Let's just do a little heart check on her. Good girl. Do we have emergency drugs? Because I think she's gonna die. Let's just get whatever we've got. Things are really touch and go at the moment. Cookie's in a really critical condition. Okay, good girl. Connected and ready. She can go back. Good girl, Cookie.
A frail Cookie is finally receiving Hulk's blood.
You're all right. You're okay. The next 10 minutes are the most risky period for a transfusion reaction, so we're going to be monitoring her really closely to make sure there's no spikes in her heart rate or respiratory rate or anything like that that would have us concerned that she's having an adverse reaction to the transfusion.
As Cookie's condition continues to decline, everyone's hoping the vital blood donation is not too late.
I know she needs this blood transfusion to save her, but we still may not be able to save her. It's all right, sweetheart. You're gonna feel better soon.
And again, just like her abdomen, there's a lot of fat. A lot of fat.
In Atlanta, Georgia, Arvid is removing the corkscrew-style tail of English bulldog Duchess that's been causing constant discomfort and infection.
Because of the inflammation back here, it makes it very challenging to deal with this blood supply here. So there's a lot of blood vessels bleeding. And there's the tail. But it's gratifying to know that Duchess is gonna feel so much better and not have to keep dealing with these constant recurring infections in her tail area.
After hours on the table,
And we're done.
Duchess's 2 surgeries are complete.
The goal now is to get Duchess up and monitor her really close as she's coming up out of anesthesia. It's probably the most critical part of the procedure.
Hey, big girl. How are you? You did a great job.
It's taking Duchess a long time to wake up, and that's my issue with brachycephalic breeds like bulldogs. Don't want to take her tube out too soon because she can fall back to sleep and actually suffocate. We got to keep a very close eye on Duchess as she's recovering.
I know, Duchess. Oh, baby girl.
For owner Jasmine, it's been a stressful wait.
The last 5 hours were nerve-wracking. I was tremendously nervous, you know, waiting and just being very anxious to see when it would be over.
All right, so she looks good.
Well, thank you so
Duchess,
much, seriously,
yeah.
because
Oh,
I
no,
know
you're
this
welcome.
is gonna change the game for her.
Yes, indeed.
Okay.
Because when you remove that tail, like you're taking a big pocket out of there, so
Right.
it leaves like a big space.
Mama, you look so nice. Well, it looks good.
Yeah, it looks good.
It looks good. It looks good.
Thank
It doesn't
you.
look
Thank you.
like what I was in my mind thinking, like, oh, it's gonna look so weird without, but it
No,
it
and
looks
when the hair-
smooth.
when that- it's smooth, and now the air is going to get to it. It's not going to have those folds.
Good.
That's going to trap moisture, so that's going to eliminate the infection and all the pain and everything. You're not going to have to do any of that.
Well, you worked your magic today. Thank you so much.
Oh, you're very welcome.
I just am so excited for Duchess. She can just have a normal, happy life, and then we can relax, and it's just gonna be a lot of stress relief for everybody. Mama, you wanna go home?
In Melbourne, Danny is making a home visit to check on a patient at a local wildlife shelter.
Hi, come in,
Michelle,
Danny.
how are you?
Good, thanks. Come in.
It's good. Got a patient for me, I
Yes,
hear.
I have.
Michelle runs one of the largest animal rescue shelters in suburban Melbourne.
I have 60 different animals at the moment. Possums, lorikeets, galahs, cockatoo, a shingleback.
Michelle's latest arrival is an injured magpie.
Where's this little Maggie hide? Gonna come out here, we'll bring him. Oh, sweetheart, okay. I absolutely love magpies. They do get a bit of a bad rap, but they can be such lovely little characters, so I hope people learn to love them a bit more. So what's happened to this little guy?
It's been attacked by a raven. It's got an ulcer in its eye and it's got a puncture in its head.
Oh, sweetheart, you poor little thing. Carers like Michelle are just, they blow my mind. The commitment that they put into what they do is just phenomenal. Her whole life revolves around these animals and, you know, without her help, they wouldn't end up back in the wild. All right, here, mate. That's all right. Here, oh, darling. It's all right, there. Yeah, sweetie. So that eye there, it's all caked over at the moment. I need to get a bit of saline to clean up that eye a bit to see what it looks like underneath. I'll hand him back to you so we can have a little look at that eye. So the discharge is basically from infection and inflammation.
Right.
Just lots of white blood cells and inflammatory fluids. After clearing away the discharge, I can see that those eyelids are quite swollen. He's also not wanting to open and shut his eyelids by himself, so whether that's just from all that swelling or whether there's some neurological damage, only time will tell. All right, so we'll just see if we can stain up that cornea to have a look for any ulcer. We use a dye called fluorescein to show up any defects in the cornea. So we can have a little look and some magnification. Very groovy looking magnification. So we'll just have a little look to see if there's any ulcers there. Okay, so there certainly is an ulcer there. So I think the best thing at this stage for this little Maggie is going to be lots of TLC, some antibiotic eye ointment, and ideally a bit of pain relief and anti-inflammatory to help with the swelling around the eye as well. And then we'll just have to keep a really close eye on the eye. We'll have a little look at this laceration that was on the top of the head too.
well, that's healing up really nicely, so I'm not too concerned about that. There's no sort of signs of infection going on there. Doesn't look very inflamed anymore. So what have you been doing? Perfect. Good job. All right, so it's just that eye, and hopefully we can get that back under control and we can get him back home again.
Terrific,
yeah. Hey.
Thank you so much for that.
Oh, it's such a pleasure. Such a good little patient, though, hey? You have?
Before Danny leaves, Michelle has a surprise.
Who's in here? Come on, Bubba.
Oh, Michelle, what a treat. I wasn't expecting this.
I thought you'd like to see them. They're
Oh,
so beautiful.
yeah. They're just gorgeous.
And they were due for a feed, so
Why
gives
not?
me a break.
Oh, got a little ringtail possum here. Oh, darling. Are you going to have a feed? How often are you feeding these guys at the moment?
Every 4 hours
Yeah.
through the night.
Yeah, great.
Hopefully within a week or two they should be old enough to start drinking themselves, where I can just leave the milk and the branches in there, but at this stage they still need mum's milk.
Here in Michelle's property, it's like a little sanctuary for all these animals. She's just doing such a remarkable job. It's just mind-blowing. It must be impossible not to get attached when they're so cute.
Oh, it's very hard. They're just so cuddly.
It feels amazing being a vet and actually being able to make a difference with wild animals, to be able to actually step in and get them back out to where they belong. It feels really good.
In Sydney, Cookie the ferret went home the day after her blood transfusion, but sadly died not long after. Her owner Michael and his mum Beck have built a backyard memorial to the pet they rescued and loved, but who was not strong enough to survive a fatally low blood count.
There was nothing that we could really do. Her organs shutting down, barely being able to move and having breathing problems. So even though that she's gone, she's still creating beauty around her. Look at that, Cookie. He's got the hiccups.
Michael now lavishes all his love on Cookie's lively mates Hulk and Princess.
Ain't that right, buddy?
But Cookie will never be forgotten.
What are you doing that for? Even though she had all these problems with her, she was always loving, she'd always sleep on your lap, always a happy spirit, and she was always jumping around and being happy and always making sure that she was living her life to the fullest.
This is pretty big.
In Sydney, it's good news for Jess's dog Missy. The laboratory results on her tissue samples came back negative for cancer.
Good girl, Missy.
The lymph node swelling was caused by an infection, which cleared up after a course of antibiotics. As a result, owner Jess has resumed the 5-year-old's vital role as a regular blood donor at SASH.
Inside. Good girl.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way. That way. Yeah.